Okay, next we're going to talk about the respiratory system. The respiratory system, we oftentimes think it's just the lungs, but it really includes so much more than that. The respiratory system includes the pharynx, which allows the passage of air and food, the larynx, which is responsible for speech, the windpipe, which is the trachea, and that brings oxygen into the lungs. The bronchus are those big tree trunk type things that go down into the lungs, and the bronchioles are like the little finger-like projections from that. So the functions of the respiratory system, it filters the air that we breathe. It brings oxygen to the lungs, which is the trachea. It removes carbon dioxide from the lungs. That's the alveoli that does that. And it produces sound associated with speech, which is our larynx. We know respiration is the process of taking in oxygen and removing carbon dioxide. So inspiration is breathing in. That's the active phase. So go ahead and inhale and take a deep breath in. As you do that, you can feel the lungs expanding. That's the active phase, okay? The exhaling, that is the passive phase when we breathe out and the lungs relax. The chest cavity gets smaller. So that is respiration, inspiration and expiration. Changes in the respiratory system due to aging includes that the lung strength decreases. The alveoli become less elastic and decrease in number. So it's harder for that carbon dioxide to get out of the body. The lung capacity decreases and the chest muscles weaken. These are all changes in the respiratory system due to aging. We also have noticed in our residents that the voice weakens, the oxygen in the blood can decrease, and the cough reflex becomes less effective. What should we be concerned about if the cough reflex becomes less effective? Maybe pneumonia, because the mucus gets stuck down in there and you can't cough it up, and then that can become an issue. So speaking of pneumonia, let's talk about some of the disorders of the respiratory system. First of all, let's discuss chronic obstructive pulmonary disease, or COPD. Now, we know COPD is chronic, which means that it's ongoing, long-term, and progressive. So it's going to get worse over time. COPD, chronic bronchitis, and emphysema fall under that. Often this is from smoking or secondhand smoke or pollution in the air. What happens is that with chronic bronchitis, there's inflammation of the lining of the bronchi, and this can cause scarring and excessive mucus production. With emphysema, the walls between the air sacs in the lungs become overstretched, and the air sacs weaken, and that air gets trapped, so normal breathing becomes impaired. There's no cure for this, and this is very common in people who smoke or have chronic bronchitis. So this can really be hard too when they're exhaling. They can't get, the air is trapped in their lungs and they can't get it out, and they feel like they're suffocating all the time. Another disorder of the respiratory system is pneumonia. So pneumonia is an inflammation of the lungs, and this can be caused by a virus, a bacteria, or irritants. So somebody chokes and takes food down into their lungs rather than into their stomach. That irritant can cause aspiration pneumonia, or it can be caused by, we said, like a virus or a bacteria. Elderly are at a higher risk for developing pneumonia because they have weaker immune systems, ineffective cough, and the immobility, laying in bed, not up and moving as much, is going to put them at a higher risk for pneumonia. When we think somebody might have pneumonia, we're looking for fever, chest pain with inhaling, coughing, shortness of breath. They may be having chills or a rapid pulse. If you're seeing any of this in your resident, you should be reporting it to the nurse and suspecting that they might have pneumonia. One last thing, look over the specimen collection handout and read the guidelines for a sputum collection. It's important to know that sputum collection comes from deep here in the chest. It's not coughing it up from the throat. It's coming from the bronchus. Also, the best time of the day to get a sputum specimen is early in the morning. And you want them to hawk that loogie up and spit it out into that cup. And then make sure you're not brushing their teeth or using mouthwash prior to collecting that specimen.